All right, quickly, do you want the good news or the bad news first? Too late, we're going to start with the good news. Portland's plan to handle mental health and homeless issues without police is finally up and running.
It's enormous. It's like we're turning a corner.
The bad news, it's only in one neighborhood, and organizers don't know where they're going to get the funding to expand the program. And we've been getting a lot of emails about a story involving Fred Meyer, Portland police, and a dumpster full of food. So let's take a step back and look at what we know about what actually happened. And I know, you still can't get contact tracing alerts on your phone here in Oregon. So how about a warning for the big one instead? Doesn't that just ease the tension? Here's the story.
All right. Hey, I'm Dan Haggerty. Thanks for being with us. All the ways to contact us at the bottom of your screen. Use that hashtag HeyDan if you reach out on Twitter. I also want to tell you, if you're on Twitter and you search in the search bar, hashtag HeyDan, you can see what everybody is talking about using that hashtag. So just the little community of people watching this show, the things they're interested in, the critiques they make. If you want to see what other people are saying, just search that and get involved that way. Now, look, I wanted to start today on a positive note and talk about the big one. Stay with me for just a moment. I'll get there. Now, for anyone, I guess, who doesn't know the specifics of the big one, scientists think this region is a ticking time bomb. It's about, 200 years overdue for a legendary and catastrophic earthquake. Seriously, the positive stuff is coming soon. Scientists are so certain that this will happen and that it will be so devastating, causing buildings and bridges to collapse, water and power to be out for weeks, and a deadly tsunami to crash into the coast. I'm going to turn all this around to some positive stuff in just a second. That they have spent years developing an alert system capable of warning you on your phone moments before it happens. And drum roll, get the inspirational music ready. Do we have it ready? We do. The system will be available in Oregon on your phone by March 11th. We are the champions. We are the champions. A little much with the music, a little cocky, but you get my point. Also, it'll be ready in Washington a few months after that, in May, meaning by this spring, we're all going to be a little bit safer. And Oregon finally beat Washington to the finish line on something tech-related. See, last night, we told you how Oregon is still struggling to roll out that contact tracing app they've been talking about for like forever, despite the fact that Washington and a bunch of other states have one and have had one for a while, Washington since November. And when we brought that up, it was kind of the first time we'd talked about contact tracing in a while. Susan Lee emailed me and had a simple question. Are we doing any contact tracing? So, yeah, we are. I mean, for example, Multnomah County, they have about 100 people who are making calls. They talk to people who tested positive. They contact the people who they came in contact with to tell them that they might have been potentially exposed to the virus, that sort of stuff. But today I was interviewing somebody from the county, and I learned something that I didn't know until today, that during those phone calls, the county also asks, basically, how you doing otherwise?
How often do you talk to somebody to initially tell them that they have come in contact with somebody who tested positive for COVID, and you end up getting into a bigger discussion about the other needs they might have when it comes to rent assistance or a family that might need some help getting food? How often does it change in that way?
Yeah, well, it's part of our phone call. Everyone that we call, we do offer those services to. So we find that many people are in need. And I think we all know in our community right now, many people, whether they've been directly impacted by COVID by having it, or if they've been impacted through employment, there are many people in need in our community.
What'd she say there? She said, there are many people in need in our community. People who have never been in this type of need like this before. And yesterday, we saw a tangible and dramatic example of that. Pictures and video from the Hollywood West Fred Meyer, they started going kind of viral here locally. Here's the story. This is what happened. The store lost power, right? So their coolers couldn't keep the food cold. They filled dumpsters with food that was spoiled or spoiling. And the next thing you know, a crowd showed up of people. They started to grab whatever they could. Employees tried to stop them, but the crowd got confrontational, so they actually called police. Officers stood guard over dumpsters of food. Read what this person wrote. They said there was enough in those dumpsters to feed thousands. So people, they wanted to know, Why was that food thrown out the way it was? And more importantly, why wasn't it donated? So we had Kgw find out.
It seems like a reasonable solution, right? That food is thawing out. Why not just donate it? But food safety experts say you can't. People might get sick. First, though, Fred Meyer, their response. We reached out. They provided a statement. A spokesperson says, in part, unfortunately, due to loss of power at this store, some perishable food was no longer safe for donation to local hunger relief agencies. Our store team became concerned that area residents would consume the food and risk foodborne illness, and they engaged local law enforcement out of an abundance of caution. We apologize for the confusion. And a food safety expert from Oregon Department of Agriculture really backs them up. He says you can't. If food is beyond that safe temperature for 4 hours or more, restaurants, stores, businesses, grocery stores, they've got to throw it out. It's not safe. People could get sick with things like E. coli or salmonella. And same goes for folks at home. If your refrigerator goes down or freezer starts to thaw, you've got a small window to use that food. Otherwise, you've got to get rid of it. Best advice is, he says, when in doubt, throw it out. Kgw, KGW News.
Now look, there you get it. Those are the facts of the story. All right, that's what the doctors and the science and all that stuff says. People are still outraged about all this. And I understand the outrage because this is an outrageous story. And usually when we see something like this and people are outraged, they want to blame someone. They want to blame Fred Meyer or the police who are guarding it or the nonprofits for not being able to swoop in and get that food to the families who need it. And you feel free to be outraged and to complain all you want, hit retweet all you want. But hopefully this all inspires you to do a lot more than that, because I want you to take another look, a closer look at those pictures. Ignore the food. Look at the people. Look at their clothes. Nice coat, nice shoes, rooting through a dumpster for food. What does that say to you? It shows me how quickly things can change in someone's life. How one day you're buying a new pair of boots, and before they're even worn out, you're stepping over spoiled meat to look for something salvageable in a dumpster behind a grocery store. That should tell you something. That should speak to you. If not, listen to what the Sunshine Division told me today when I talked to them about this. They're a nonprofit. They partner with the Portland Police. They work with families and they provide food and clothing and a whole bunch of stuff. Listen to what they told me today. I'm watching this scene play out through pictures online of people rushing this dumpster, being kept back by police, and it just really struck a chord with me. And I thought, what do we need to know about the hunger situation or the need for food in our community?
You know, I would start by saying this is my 9th year at the Sunshine Division. It's an organization that's been around nearly 100 years. And this is unlike anything I've seen in my nearly decade with the organization. It's pretty startling, the need that we've seen. When in a single year, not even a year, in a 10-month period, we're helping about 9 times as many households as we did in the previous non-pandemic sort of time frame. I don't have the words for that. The unprecedented doesn't do it justice. There are hundreds of thousands of Oregonians that are struggling right now. Tens of thousands of families who have never had to ask for help before are turning to us for the first time. And I know our organization is not unique. This is the same story that's playing out across the country. And so I really would ask people that are listening to really look at that organization in your community that you have faith and trust in, that's helping people, because the need has never been this high.
Now, if you were affected like me by this story, you're probably thinking, well, what can I do to help? Well, you can start by looking for organizations in your area that take food donations, and these could be food banks, pantries, churches, schools, that sort of stuff. The best thing to donate are those non-perishable items, so not meat or dairy or anything like that. Unless it's canned meat, they do need a lot of that. You know, basically, think of stuff that could last in your cupboard for a long time and has a good nutritional value. Would you eat it? Would you be able to make a meal with it? Also, KGW is starting our Great Food Drive next month. So that's going to be another way to help moving forward. Now look, on that note, let's continue to talk about solutions to the problems in our community. Last night we introduced you to the Portland Street Response. It's that program that sends paramedics and mental health experts instead of police to calls involving mental illness or addiction. Now, for those of you cheering right now and saying, yes, this is what we've been talking about this for a long time, here we go, the entire city needs a program like that, not so fast. Because most of this city will never see these people, not for a while or maybe ever. Here's Maggie Vespa.
After years of buildup, Portland Street Response is off and running. They took their first calls Tuesday morning.
We were anxious and just ready to get started.
The Portland Street Response team, seen here in video provided by the city, includes a program manager, a firefighter paramedic, a mental health crisis clinician, and 2 community health workers. Instead of armed police officers, 911 dispatchers will send them to nonviolent calls involving mental health or addiction. It's based off a decades-old model in Eugene. In 2019, the local paper Street Roots published an op-ed demanding a Portland version.
Honestly, last night I got a little teary.
This week, they got what they wanted.
It's an enormous shift of the imagination, of the social imagination, and I think we're ready.
And arresting people isn't helping.
John has been on the streets for a year. He agrees amid Portland's growing housing crisis, this is desperately needed.
The officers aren't equipped to deal with what is going on out here. They're equipped to deal with criminals and not people who have a drug addiction and are sleeping in tents.
That said, despite all the support for Portland Street Response, there is one caveat, at least for now. Keep in mind, this is just a pilot project at this point, so right now the team will only respond to calls in Portland's Lents neighborhood. For those not familiar, Lents is a pocket of southeast Portland east of 82nd Avenue and south of Powell Boulevard. Officials chose it for the pilot because it's diverse, it's lacking in services, and they say calls about mental illness and addiction have risen faster here than across Portland as a whole. But for those eager to see Portland Street Response operating elsewhere, say downtown, they'll have to wait. Officials plan to study how this works in Lents for at least 6 months, maybe longer. The goal is to expand it citywide by 2022. There's just one problem: money. This pilot project is costing the city $4.8 million. Most of that came from one-time cuts to the Portland Police Bureau's budget. The result of calls amid racial justice protests to defund the police. Frankly, no one can guarantee that will happen again, even if it's done with the goal of expanding Portland Street Response.
Whether it's healthcare organizations, whether it's Medicaid or Medicare at the national level, what we're looking at is what would be the funding source to make this a citywide effort.
Officials added the city's general fund is not an option. Thanks to COVID, Portland faces a massive deficit. Maggie Vespa, KGW News.
Now, Portland's not the only city taking a different approach to the mental health crisis. This is a story from OPB we think is worth your time. The police chief of Gerhardt, that tiny town on the Oregon coast next to Seaside, is no longer sending his officers to most mental health calls. He says they're simply not trained to be counselors and knows that people in crisis situations may not want to deal with a police officer. Now, Clatsop County does have a mobile crisis response team, but they're also having a funding issue with only one crisis worker available 24/7. The police chief is advocating for the state to step up and get more mental health services up and running.
People living in Oregon adult care homes still can't figure out how to get the vaccine.
So I feel like we're being overlooked.
So what is the holdup? Well, we've been trying to get answers from CVS and the state all week.
DHS oversees these adult foster homes. Should they have thought about this? Should they have done this sooner?
When the story continues.
Hey, welcome back. I was just looking through some emails, responding to a few tweets. You're not the only one scrolling through your phone during the commercials. Don't feel bad. Keep them coming. Use that hashtag #HeyDan. We also have a new way for you to connect with us and stay informed. We're going to be launching the Story newsletter next week, and it's going to be full of all the stuff that you may have missed on the show. I know you can't watch every single night. Plus some of the stuff that we can't exactly fit in every night. We're only a half-hour show, and there are so many issues and things that we talk about every day that just don't make the cut each and every night. We've got an easy way for you to subscribe if this is something you're interested in. Just text STORY to the number you see on your screen. Text STORY to 503-226-5088, and we will send you a link where you can sign up. Now look, we on this show like to call out kind of the trite TV terms that the news likes to use, like a voice to the voiceless. That's definitely one of them. Every TV station uses it. It's in every news reporter's bio. But I really don't know how else to describe this next story. Now, Kristen Severance has been trying to get answers for the thousands of people in adult foster care for days now. Many of these people are bedbound. I have to remind you, they're in wheelchairs. They can't be driven to these mass vaccination sites, and they are desperate to get the vaccine. And I'll remind you again, according to the state guidelines, they should have been some of the very first people in line, and instead have been forgotten.
Dan, bottom line here, these people need help and they feel like no one is helping them. Ray is 95 years old. Look, he's holding a sign saying, please help me get my vaccine. We are trying our very best to do that. Carol is on oxygen. She hasn't been able to hold her granddaughter in 6 months. All of these people live in an adult care facility in Tigard. The woman who runs the facility, Gina Roberts, has been trying her very best to get them vaccinated since December and getting nowhere.
Oh, it's extremely frustrating. I know that our people, they feel like they're forgotten. Ray that you showed the other day, he's a veteran. He's an Air Force pilot. Carol's a teacher. We have a retired police officer here. These are people that all contributed to society. They all paid their taxes. They're all loved by their families. They need help, and we don't know what to do for them.
Gina Roberts runs a place to call home in Tigard, one of 1,400 adult foster homes in Oregon. She's been trying to get her 5 residents, like 95-year-old Air Force veteran Ray, the COVID vaccine.
Ray, what would it mean for you to be able to get the vaccine?
I could see my family, for Pete's sake.
CVS was set up to vaccinate her residents February 10th, but canceled, saying they could not confirm if there was a common area or on-site coordinator. Gina, who is the coordinator, told them she has a common area. She has not heard back from the pharmacy.
No, they haven't contacted me. Nobody's called me. Nobody's emailed me. No one's reached out at all. Like, who is in charge there? Are they just heartless? Like, they don't care? I don't understand. Are they so busy with other things?
Adult care facilities were supposed to get the vaccine through a federal program, but only 172 out of the 1,400 in Oregon signed up. Fred Steele, Oregon's long-term care ombudsman, said the information wasn't communicated properly to the adult foster homes.
There should have just been more communication and more direct communication with these smaller foster homes.
Oregon's Department of Human Services sent a letter to all adult care facilities on Tuesday, the day after our first story with Gina. It said staff will be reaching out over the next few weeks to connect them with a pharmacy partner or mobile clinic.
DHS oversees these adult foster homes. Should they have thought about this? Should they have done this sooner?
In hindsight, that's easy for me to say that yes, they absolutely should have. But DHS was relying on systems that they've had in place for probably decades, at least years that I'm aware of, to communicate with those foster homes. Just that old style of communication, the alerts they send out, just wasn't sufficient and satisfactory to meet the needs now. For the vaccine distribution.
Gina, who did register and is still having issues, is not that hopeful DHS can help.
And they're doing the best that they can, but obviously they don't have the power to make something happen. They don't have direct access to the vaccines. We really need someone that's going to step up for us, whether that's CVS or Walgreens or some other company. Somebody that's in charge needs to figure out what it's going to take to get us some help.
Residents desperate for help and to see their families.
I'm lonely. I would just like to have more personal contact.
And it makes me mad that they haven't been able to hug their families. I have a lady with dementia. It's really important for them to be able to connect with their families so they don't forget them. They need to see them on a regular basis. They need to be able to hug them. They need to be able to, it's so frustrating.
I did hear back from a CVS corporate communications spokesperson. They said they are working with the Oregon Health Authority to get the vaccines to Gina's home. I'll be following up.
Kristen, thank you. Lots of people want to know when they will be getting the vaccine. When is it your turn? We've been hearing from a lot of you trying to make appointments or really just wondering when you're up. Right? So we sent your questions to our vaccine expert, Pat Doris. He's also got some updates on a vaccine supply issue here in Oregon.
There's been a lot going on very recently in the vaccine world, and the latest update we had is that Oregon is expecting about 67,000 doses of the Moderna vaccine that have not arrived. They're probably stuck in Tennessee. We understand that no planes left there today, and it's iffy whether any are going to leave there tomorrow. Those doses were supposed to be in the state yesterday. But if there's healthcare organizations that have a good supply on hand, it may not actually impact their clinics, like Multnomah County, who's expecting about 8,000 doses. But they say they have enough reserve on hand that the clinics will go forward as scheduled. So not as big an impact on them. But some of the other clinics that are smaller around the state, from Eugene to Roseburg to you name it, they may be in a position where they need to reschedule. So if you're scheduled to get a Moderna shot, be watching for an email that you may need to reschedule. All right, moving on now to some questions that we got. Mike wants to know, whatever happened to Johnson & Johnson's vaccine? Mike, I was just asking that same question this morning. I'm so glad you asked. Here's the deal. Dr. Anthony Fauci said that it's a couple of weeks away from final approval or disapproval from the FDA. So it's in front of it right now. And that's a one-shot vaccine. Also, they warned that even though Moderna has promised to have, even though Johnson & Johnson has promised to have 100 million doses by June, in the beginning, it's not going to be nearly that many. There's only a few million doses available right now, they said. The government's trying to ramp that up. So far, has not happened. So that is what's going on with Johnson & Johnson. Also, Paul wants to know, I just want to know when high-risk, immunocompromised group of Oregonians will get their chance to get the vaccine. Excellent question as well. And it seems so far that Oregon really has been focused on people who are working. So the hospital workers, the teachers, that sort of thing. Now they're moving into the seniors. The short answer is it could probably be early April, because that's going to be in the 1B category, and that's probably when the state is going to get to that group. So look for that in early April. We've got a couple of months to hang on for that. All right, that's the latest from what's going on with the COVID vaccines.
All right, Pat Doris, thank you as always. Let's check into our daily vaccine count check right now. As of this afternoon, more than 496,000 Oregonians have gotten at least their first dose of the vaccine. A lot of them have gotten their second dose, but this is people who have gotten at least one shot, and that puts us at about 11.6% of the state's population with that first shot. Now, in Washington, under their vaccine numbers, they update their vaccine numbers 3 times a week. So as of the last update, more than 807,000 people had gotten their first dose. That works out to be 10.7% of the state's population. Now, we've been talking a lot about the snow and the ice and all that stuff this week, but one of our viewers challenged us to find the oldest snow video we have. We went back 6 decades into the Kgw Vault. We're going to finish the story with it right after this. Welcome back. One of our favorite segments on this show is the Kgw Vault. We dig around in our archives and we find old clips from the past. We love when you send in suggestions, is usually why we go down there. Dave sent me this one. After a snowstorm, does the Vault have anything about the snow on 2/14/59? Let's do the math. That's about 62 years ago. It's usually kind of hard for us to find stuff that's that old. But Dave, you are in luck, my man. We did find these clips of snow from 1959 in the Kgw Vault. We're not sure the exact date when this was taken yet, a specific ask there, 2/14. But this was that year, the same year you asked. You look at the cars. How about this? This is a paper boy getting his job done. You got to get the work done even in the snow. If you have an idea for the Kgw Vault, we'll do our best to find what we can for you. Just use that hashtag, Hey Dan. A lot of people writing in, curious again about Fred Meyer throwing away that food and talking about how some of it was still salvageable. More or less, you have to remember, these businesses don't want to throw away food. They want to sell that food. And we ran into a very similar problem, if you remember, when the businesses were shut down at the very beginning of the pandemic, and all those restaurants had to throw out a bunch of food that they had for prep, and people were thinking, why couldn't those just go to food pantries? But there are very specific rules in place for a reason there to keep people from getting sick. But again, there are ways to help out right now. We tried to show you in this show how desperate the need is. You can help out. If you're passionate about it, if you're upset about that story for any reason, find a way to help out. Also, Max said, hey Dan, breaking the word solution, as we're doing our solution segment, into 3 segments so that UTI is in the middle of the screen might be worth reconsidering. I'm going to take another look at the air check on that one, Max. I appreciate the feedback. That's the story. Use the hashtag, hey Dan, I'll see you tomorrow.